Welcome to the deep dive. Today, we're jumping straight into something pretty significant in digital health. We're looking at the Q3 2025 earnings call, specifically the prepared remarks from CEO Andrew Dudum. And this isn't just about the numbers, right? It feels more like a strategic blueprint.
Oh, absolutely. More than just financials. For you listening, what we want to do is kind of peel back the layers on this. Understand how this major digital health player is fundamentally shifting its whole business model.
Shifting how?
Well, moving away from just, treating specific conditions people already have and moving towards becoming this platform for proactive health management, personalized and global too.
Okay, and the core idea the CEO kept coming back to, the thing driving all this, is that scale getting bigger doesn't just mean more revenue, it actually makes the experience better for every user.
Exactly. It's that feedback loop. More users, more data supposedly means better, more personalized care for the next person. They're essentially betting that the sheer volume of interactions gives them an edge, maybe even surpassing traditional care in some ways.
All right, so let's dig into that. Does the scale makes us better idea hold water? What are the proof points? They did throw out some numbers. Subscribers using these personalized solutions up 50% year over year.
Yeah, 50%. And that wasn't just vanity metric growth. It helped drive revenue up by almost the same amount, nearly 50% year over year. That's pretty substantial traction.
So the growth is there. How does that connect back to making the experience better, like the CEO claims?
Well, the argument is that every interaction teaches the platform something. What dose works best, which product form factor leads to people actually sticking with the treatment, how to combine treatments for folks with multiple conditions.
So it's like collective intelligence. Instead of starting from scratch with each patient, the system kind of knows what's statistically likely to work based on thousands of others.
Precisely. It potentially cuts down that frustrating trial and error period. They can get more precise, faster. But, the challenge there is keeping it feeling personal, right? Not just algorithmic. How do you balance that data efficiency with, genuine human connection?
That's a good question. The script suggests their answer is partly about accessibility. By using data to lower costs and improve effectiveness, they build trust through results, maybe, and can then offer more complex solutions.
So banking on results over perhaps the traditional bedside manner. Interesting trade-off. And this whole evolution is really mapped out in these 3 stages the CEO described. Stage 1 was the beginning, right? Simple treatments for just a few conditions. Reactive.
Right, like the early days of Hims&Hers. Then stage 2, that was the move into personalized plans for multiple conditions. Managing, say, hair loss and anxiety together under one roof, that was the big value add for a while.
Exactly. But stage 3, that's the future they're building now, and it's much more ambitious. It's about getting ahead of problems, proactively managing health before you even get sick, making care personal, proactive, and connected, as he put it.
Sort of like risk elimination rather than just treatment.
Yeah, that's a good way to put it. And this isn't just talk, right? This evolution connects directly to those huge 2030 goals they've set. We're talking over $6.5 billion in revenue and $1.3 billion in adjusted EBITDA.
EBITDA earnings, before interest, taxes, depreciation, amortization, a key profit measure.
Right. And what's interesting is the CEO's comment that these opportunities are actually materializing quicker than anticipated. It suggests the market is maybe catching on to this proactive health idea faster than even they thought.
That confidence probably explains why they're making some pretty bold moves with partnerships and investments. Yeah, let's talk about those. Partnerships seem key, especially for complex drugs. First, weight loss. They're actively talking to Novo Nordisk about offering Wegovy injections. And the oral version, too, once that gets FDA approval.
That's huge.
Yeah.
It positions them as a major channel for one of the biggest drug companies in the world. But they're also looking at areas where treatment is just, difficult, like testosterone therapy. They've partnered with Marius Pharmaceuticals for an FDA-approved oral testosterone option coming in 2026. That's a big deal for adherence.
Easier than injections or gels, presumably. And then the other big one, diagnostics. The investment in Jerail, integrating a multi-cancer early detection test, that's a different league.
It really is. The CEO called it the most advanced test of its kind. This isn't just adding a feature, it fundamentally underlines that strategic pivot toward prevention. You can't really be a proactive health platform without top-tier diagnostics, can you? It's a necessary, if probably expensive, piece of the puzzle for that stage 3 vision.
Okay, let's swing back to weight loss for a moment. They called it one of the biggest global health challenges, nearly 1 billion adults affected. The strategy seems to be combining access to meds, like GLP-1s, with data-driven support and tracking tools.
Right. And the engine behind their confidence here is something they call verticalization of their compounding infrastructure.
Verticalization. Okay, break that down. What does that mean for someone using their service?
It basically means they control the whole supply chain, or at least much more of it, from sourcing the actual drug ingredients to getting it to the patient. They're building this infrastructure in-house, aiming to be the, quote, new gold standard. Gives them huge control over quality and safety.
And they got specific about that quality, didn't they? Mentioning API.
Yeah, API, active pharmaceutical ingredient. That's the core drug stuff. They made a point of saying it all comes from FDA-registered facilities.
And for semaglutide specifically.
They stressed it's only sourced from suppliers on the FDA's green list, which, simply put, means the highest quality, most vetted sources globally. So they're trying to build confidence by controlling that crucial first step.
And controlling it leads to cost savings.
Apparently so. The direct result they highlighted was a price reduction up to 20% on their compounded GLP-1 plans. Plus, they added microdosing options for compounded semaglutide. That allows for more fine-tuning, more personalization. Okay, so beyond weight loss, the next big growth engine seems to be hormonal health. They're targeting conditions where access is often, let's be honest, pretty difficult or confusing for patients.
Like low testosterone for men, they mentioned tackling stigma, offering personalized plans with at-home testing, and the CEO said it showed immediate product-market fit. Sounds like they hit a nerve there.
Definitely seems like it. And then for women, under the Hers brand, there's the big menopause offering. And the context here is just staggering. You have nearly 1.3 million U.S. women entering menopause each year.
Yet only 30% of OBGYN residency programs offer formal training. 30%.
Yeah, it's a massive gap in care. It explains why they see this as such a huge opportunity. It's not just a market opportunity, it's addressing a real failure in traditional women's healthcare.
And the goal reflects that scale of opportunity, right? They expect this to help push the Hers brand towards, what was it, $1 billion?
$1 billion in annual revenue in 2026. That's the ambition for Hers, with menopause being a key driver. It shows just how big they think this hormonal health gap is.
Which brings us to the really forward-looking stuff, the full proactive vision. It hinges on that comprehensive whole-body lab testing service they're launching soon, before year-end.
Yeah, and this is framed as a huge democratization play. This kind of testing looking at vitamins, hormones, genetic risks, early signs of cancer or heart disease used to cost, thousands, maybe $10,000, the CEO said.
Wow.
And they're bringing it out for, quote, an absolute fraction of that, making proactive insight accessible.
And that testing infrastructure then enables the next big specialty launch, longevity, planned for 2026.
Right, and longevity can sound a bit like sci-fi or something, only for the super rich. But again, the framing is all about democratizing access to things previously out of reach for most people.
What kind of things are we talking about? Peptides.
Exactly. They mentioned specific peptides like BPC-157 and TB-500, which are often used in advanced recovery and anti-aging circles. Also things like coenzymes and potentially GLP-GIP treatments aimed at improving performance, recovery, and those cardiometabolic markers associated with longer, healthier lives.
And they're building the infrastructure for this.
Yeah, a peptide manufacturing facility in California, bringing R&D onshore. So the goal seems to be taking these cutting-edge, almost elite health protocols
and making them available to their regular customer base, moving from just fixing problems to actively enhancing health span.
That seems to be the end game for stage 3.
Okay, so they've got this ambitious plan for the U.S., but they're also looking outward, big time. Building on their success in the U.S. and U.K., they're going global.
Massively global. The Zava global acquisition is the key piece in Europe. That gives them instant infrastructure in the UK, Germany, France, Ireland, and Spain.
Covering an addressable market of, over 200 million adults. That's huge.
It's a massive potential market, yes. But we should note, navigating those different European health systems, regulations, that's incredibly complex. It's not just plug and play.
A big operational challenge then. And closer to home, North America.
Canada is next, launching soon. They cited the high rates of obesity and overweight adults there, 2/3. And they're already talking about semaglutide access for 2026, when generics might be available there, using the same playbook.
So what's the ultimate prize globally?
The CEO sees it as potentially more than $1 billion in annual revenue long term. The goal is explicit: become the largest global consumer health platform. They believe the need for better access is universal.
Okay, so wrapping this up, it's a pretty radical shift we've just walked through. From specific treatments to this holistic, proactive platform covering diagnostics, chronic conditions like weight loss, hormonal health, even longevity. All built on their own, controlled infrastructure, aiming for that scale equals better outcome.
It really is a transformation. Which leaves us with a big question for you, the listener, to think about. If this democratization works, if things like comprehensive lab testing and advanced longevity treatments, stuff that cost a fortune, really become widely accessible, what kind of pressure does that put on the rest of the traditional healthcare system? What new expectations will people have when proactive, personalized care becomes the standard, not the exception?